The advantage of exams in our oncology center primarily lies in the fact that we have the entire complex of diagnostic tools here, enabling us to conduct all necessary exams and analyses in one place. This eliminates the need for patients to travel to multiple locations, saving time and effort. Our facility ensures efficient and convenient healthcare services for our patients. Clearly, there is also a benefit of undergoing breast reconstruction in a single surgical procedure. In this particular scenario, the patient goes through the surgical procedure only one time. Thanks to this, the time spent in the clinic and the time spent preparing for arrival are significantly reduced. As an example from Russia, the optimal planning of the arrival of foreign patients is guaranteed by our coordinated work with Deutsche Klinik Allianz, ensuring the best possible outcomes. We receive a comprehensive package of documents in advance and can already at the preliminary stage schedule all the necessary procedures and requirements. One of the significant advantages of breast reconstruction in our center is that the patient essentially does not notice or realize the changes made to the mammary gland, thus preserving their sense of normalcy and body image. The chest looks almost normal. Of course, at the beginning, the patient feels like any person after the surgery. However, she is not shocked that all of a sudden her chest has become completely flat or that she is missing one breast. Not at all. Looking at herself immediately after the operation, she is convinced that her chest looks completely intact. The seams are typically positioned in the submammary folds in a manner that makes the scars not readily apparent. And naturally, here we encounter the specific desires of our patients. For instance, in situations where the chest is small and it is necessary to remove the gland, we can utilize an implant in order to appropriately increase the size of the chest. Similarly, following the required medical procedure on the breast affected by cancer, we adjust their sizes to match by performing an additional operation on the healthy breast, ensuring they are in the same condition. Or, for instance, if a mutation was detected, that is, the gene associated with breast cancer, we can offer counseling services. I can personally perform a genetic consultation. It is feasible to perform additional testing and assess the results within a period of 3 to 4 weeks in order to ascertain the presence of the gene. If the gene is present, it is possible to perform surgery on both breasts, meaning the complete removal of the mammary glands from both sides. It is important to note that Dr. Krentel also performs surgical procedures on the ovaries and fallopian tubes in addition to this, as it is a standard procedure that is carried out when a genetic defect is detected during the examination. The advantage of this is to achieve a higher level of symmetry by simultaneously operating on both sides, enhancing overall balance. We have additional surgeons participating in order to. Furthermore, the duration of time spent on the operating table is decreased, and naturally, the risks of infection are greatly diminished. Violation of the healing process or rejection of the implant. We take every precaution to minimize all of these risks and ensure patient safety. There has existed a prejudice for an extended period of time that oncological diseases invariably lead to a fatal outcome. Thus, individuals frequently believe that therapy is futile and early cancer detection will not accomplish anything. Modern medicine, though, has advanced very far. It can be confidently stated that we are able to cure the majority of women who are diagnosed with breast cancer. A majority of over 80% of women diagnosed with this condition, at all stages, including severe ones, continue to live their lives.
It has been over a decade since the therapy was completed, with more than 10 years having elapsed since then.
What undoubtedly confirms the high level of effectiveness that has been achieved through the treatment process. With the assistance of modern medical research, we are able to uncover something new and groundbreaking each year. The constant advancements in medications, screening technologies, and surgical techniques continue to emerge, revolutionizing the field of medicine and improving patient care. Therefore, in no situation should one feel despair, shut their eyes to the problem. On the contrary, we must engage in the fight, and the sooner cancer is diagnosed, the more effectively we can treat it. And, as statistical data indicates, in the majority of instances to achieve an unequivocal triumph over him.